Hello and welcome back to Let's Get Oral. This is Camille reporting in, one half of the LGO team, and we are revisiting our Totality of Care series with Dr. Victor Avis and his lovely daughter, Sydney Avis. They're here to share their wild journey on airway health, a really significant and compelling story that should have us all visiting our sleep therapist and having our airway health evaluated. And it really stems from early development of our jaw. And when that doesn't go correctly, it can lead to significant issues in vitality future forward. This journey they've been on together has led them to develop the Airway Revolution, which is an organization really trying to grow awareness about airway health and early steps you can take to identify the issues and what we can do moving forward. So I'm really excited to showcase this story because I think it's an impactful one that we could all take notes on. Thank you so much for listening.
Let's get oral. Let's get oral.
Hey, we're back at the Totality of Care. And with us right now, I have Dr. Avis and his daughter Sydney with a remarkable story of how they started the Airway Revolution. Tell us about this.
Yeah, so it's the Airway Revolution Foundation, and I don't mean to jump in before you, Sydney, but since I started talking, I recognized when Sydney, about 7 years ago, Sydney, I guess the time was 24, that her issues with, focus and learning and being fatigued, anxiety, and hypothyroidism. As my education in airway disorders met her symptoms, I recognized that, oh my goodness, my own daughter, who I didn't realize till she was 24, I think she has an airway disorder that's the root cause of these myriad of symptoms that were really impacting her life in a horrific way. And,
well, let's back up because I could say that both of my kids probably have a variety of the symptoms, but my background wouldn't predispose me to understand that it was perhaps a breathing issue. So how does your background kind of inform you that these symptoms might?
Yeah, unfortunately, Camille, my background did not inform me, and that's why I didn't pick it up till Sydney was 24. And I took her to pediatric ENT when she was 6. I took her for orthodontics because I wasn't doing it at the time when she was 8, and they also
so let's just
did
back
not
up
know.
for our listeners. Your background is ortho?
My background is general dentistry.
Okay.
And then, so what I'm saying is that my background did not inform me any better than yours. And to this day, dental and medical schools are not teaching about airway disorders. So tomorrow's doctors are not being any better informed than I was in 1987 when I graduated Georgetown Dental School. And that's why we started the Airway Revolution Foundation, because when we did connect the dots for Sydney, and we ultimately were able, with Sydney's courage, to solve her airway disorder, we said that's not enough. We need to change education at the university levels. If we can get one university to incorporate airway disorder education into their curriculum, that will create, because it's good medicine, it's good dentistry, and it's good business. And if they would do that, we would change care in the future. Because right now, there's hundreds of millions of people with airway disorders, and we don't have the near numbers of skilled medical and allied health professionals to meet the need. And so our film, our documentary about airway disorders, will create a lot of frustrated people because they'll go looking for care that doesn't exist.
Right. I felt privileged to have seen the first clip today in this secret hidey hole in Knoxville. But Sydney, that was a remarkable journey that you went through and quite an ordeal. But you went into it just like both feet jumping in the fire without hesitation. Tell us a little bit about your journey there.
Yeah, I'm an impulsive person. And I just was tired of feeling terrible every day. And I felt that there was more in me that I couldn't get out, that I wasn't living the life that I could live, but I could never figure out what the problem was. And I was dedicated to my health. You know, I really explored many different avenues of like, why am I exhausted? Why is my anxiety so high? You know, what is going on with me? Why are these panic attacks happening? I just felt like things were piling up and I was healthy. You know,
Right.
I'm using quotation fingers for the people who can't see me. So it was a tough journey going through. I ended up getting double jaw surgery, and that was a tough journey. But really, what was tough was the 28 years leading up to it, and feeling trapped and feeling exhausted and feeling like, what the hell's going on?
Right.
Why am I working so hard to be healthy and I feel like crap?
Right.
So, you know, it was a short-term pain, annoyance, like it sucked for sure, but it was worth it to me if it was going to change my life and let me feel like I knew I was supposed to feel. Right. So when I heard that I needed surgery and that would potentially be the answer to my problems, I said, let's go right now. I was ready. So yeah, I can understand that it might seem extreme for some people, but when you're feeling so badly for so long, it's not that extreme. You know, it's extreme living
I think
a life that sucks.
Yeah, right. And I think
Yeah.
the numbers that you speak to, people that are affected in this way, are vastly underdiagnosed. Mm-hmm. And I mean, I know many people going for exactly these symptoms, not finding any help, and just feeling out of luck. My own mom has been struggling most of her life in this regard. And so once your documentary comes out, I think you'll build enough frustration, but will it, you know, how fast will that turnaround of education be to solve the problem?
It's a great answer, Camille. You know, the model of our foundation, which is a not-for-profit, this is a whole give back. To whom much is given, much is expected concept, kind of a mantra in my life. And I grew up in a family that, you know, really stressed philanthropy. And so we prospectively filmed this journey on Sydney. So I'd like to say I knew for sure it was going to solve the problem, but I thought for sure it would solve the problem, but I didn't know, and we still filmed it. So we rolled the dice in many ways, and Sydney really rolled the dice, and the truth of the matter, it did solve the problem, and we have evidence to show it. It's psychological testing before and after, sleep studies before and after, drug-induced sleep endoscopies before and after. I mean, things that people aren't repeating, we did. And so the evidence is clear, and Sydney is the spokesperson and the face of it. I mean, it's changed her life. But what will change it is we need a mass of people. We need this to be a grassroots movement of millions of people that say, hey, this is an epidemic, and my child's suffering, and we need care, because ultimately we need universities to respond to change education. And then also we are working. We have been to Congress. We've been there twice. We are working towards getting a congressional hearing. I can't say that we have it lined up yet, but we're getting close.
That's fantastic. You must know a lot of amazing people.
We do.
That's good to know. Noted.
Yeah, it is. Yeah, it's using those connections to try to change the space. So ultimately, we want to change care. Yeah. And to get change care, we have to have more educated physicians, dentists, speech and language pathologists, and dental hygienists.
And the list goes on.
And the list goes on.
Yeah. And working collaboratively, because I don't think you had suggested in your talk that there was no one way you could have addressed this without kind of all parties tagging in.
That's correct. We needed an ENT to do the drug-induced sleep endoscopy, which showed the disability to its greatest amount. We needed a sleep physician to test her as well. We needed a great maxillofacial surgeon, and we needed the dentist to do the ortho in combination with the MMA surgery, and we needed myofunctional therapy.
Right, and I think, I mean, it even goes beyond that, because there was so much that we were doing before, like working with a naturopath. I had an Ayurvedic doctor that I worked with. So, like, there was so much more than just kind of the ones that we immediately think of when we think of Airway. So I just think that that is a huge piece to, you know, put in there as well, of like working on nutrition and getting inflammation down and exercising. I mean, it was really a holistic piece of trying to get my health back. And it turned out for me, it all contributed, but it came down to an anatomical issue that had to be fixed via surgery to then, you know, get my health back, but all of it played a huge role for me.
So all of the improvements, it's basically a breathing restriction, but so now you can breathe. Mm-hmm. But what comes with that? You mentioned cognitive improvement.
Yes.
What else? Tell us everything that comes. That's good.
Everything. I don't even know if I can give you everything. It's interesting because there's such small things that come that we don't necessarily talk about, but it's like, because first of all, you're living your whole life the same way. So you don't really know differently. You don't know, like, I used to be this way and then something happened and now I'm feeling terrible.
Yeah.
But from then to now, and when I say now, post-surgery, it was about 3-4 years ago now, little things. I mean, socially, I did not recognize my social anxiety before. You know, I just powered through and just didn't give it a name. But just the small nuances of being able to come to a conference like this and not be panicking in the bathroom all day, which, like, I used to do. Wow. You know, no one said to me, you know, you get this surgery and you're not going to have to panic in the bathroom anymore. Wow. That's huge. Like, that is such a life improver that I can interact with people and not be in my head, oh, my God, was that stupid to say? Oh, my God, they hate me now. You know, that is exhausting to live that way. And I know a lot of people do live that way because I hear from people. Yeah.
And you lived it.
And I lived it. And that was a huge improvement. My gut is like night and day.
Wow.
Before I had my surgery, I was really struggling to eat anything. Wow. Anything I ate irritated me. I was gluten-free. I was vegan. At one point, I was only drinking smoothies because no matter what I ate, my stomach became huge, like I had an alien in it, and it was so uncomfortable. And now I need to work on my nutrition a little bit more because things aren't bothering me. So I'm like, I'll have that cookie, I'll have that brownie. Yeah. So like it's night and day what happened, which I never thought that would impact it. But I mean, there's so much. Well, it's just what I'm
I was
trying
going to say, one of the things that you talk about is how the skull forms during childhood, and you can do some preventative work very early on. And this is something that I come back to. I did my PhD in a dental school, and so I have talked to many in-peds and general dentists who don't know what to do with a 3-year-old. So everybody says, bring your kid in at 3, and then your dentist is going to be like, it's a 3-year-old. Good job, you need a 3-year-old.
Yeah, Camille, that's exactly right. Now, we have filmed with a couple of different pediatric dentists, and so there are some that know. Bill Hang, who's at this conference, and you interviewed, I mean, he's training young dentists, whether they're general dentists, pediatric, or ortho, to treat at 3 and 4. Yeah. But again, you know, I'm thinking of titrating a glass of water with a little pink fluid. If you're a microbiologist, I don't know. But anyway, you know, we're dropping little drops, but we are creating more people. But the dentistry is actually rather easy because all you're going to do with these 3 or 4-year-olds is you're going to expand the palate, which is very easy and not painful. And the harder part is to do the SLP work, which is training the children to get their lips together and to get their tongue up on the roof of their mouth and breathe through their nose. Because that's a behavioral, habitual change. But that's what SLPs that are trained, and again, they don't learn this in their SLP training, so you have SLPs that after school have to then go back to either learn oral motor and myofunctional therapy, and hygienists are learning myofunctional. But myofunctional, the children have to be old enough to do exercises that you give them. So it's really age 6 and above. oral motor is for children that are younger that can't do things on their own volition, that you stimulate, like, with a feather, and then they put their tongue in a certain way. So it's
And then you give them a treat, like a dog, right?
Yeah, exactly. Obviously, I don't do oral motor therapy, so I don't think they use a feather.
Oh, darn.
I've only ever heard you use that example, and I am not
Yeah.
exposed to it, so I'm like, yeah.
But they're stimulating,
feathers.
behavior where they can't just ask somebody to do an exercise.
Right.
And so, but that's the key for young children. You can do transverse expansion, and you can teach better oral rest posture. That's all we really have.
Right. Well, to expand on the movement of the jaw, so some of the pictures that you showed of Sydney, where she has her chin back and the jaw hasn't formed properly. So you were beautiful before, and you're, I would say, even more beautiful now, probably because you just have life to you. But aesthetically, you've changed dramatically. And
Yes.
how does that part feel? Because that could be really disorienting.
Yeah, that was daunting. I was told that I might look different, but it was kind of like, you might look different, like you'll have a great jaw. And I was like, sick, let's go, that would be great. But I look like a different person.
You do.
I mean, people have not, there's been times when I go up, hi, how are you? And they have no idea who I am.
Yeah.
And that was a really big adjustment because it was really awkward. It was uncomfortable for me and for them. So that was like a whole nother growing, period that I went through and had to navigate. But now, it's 4 years later, and I can sit here and say, like, I like how I look. I'm happy with my face. I think I'm still figuring it out. Because actually it was last night, we were at dinner, and I walked to the bathroom, and I got a glimpse of myself in the mirror, and I was like, I know that is my face, but when I was, like, preparing myself to look in the mirror, it was still my old face.
Yeah, I bet.
So it's just...
that's so wild.
It's just bizarre, and it's like, how do you really prep for that?
Yeah.
While I was healing, it was hard because I was like, I look like Shrek. What happened? I was so swollen. My face was kind of like changing different colors. So.
And how do you clean your teeth when your jaw's wired shut?
We didn't.
Yeah,
we
exactly.
did not clean my teeth.
In this case, Sydney would come to the office, probably twice a week.
Mm-hmm.
And so we did the best we could. But, I emphasized today that her surgery has really evolved. So it was 7 hours then. Now Dr. Alfie in Houston's doing it in 1 hour, and he's going to be here for you to interview.
Yeah, I can't wait.
That's a change
And
of the whole landscape.
he's also not using rubber bands to stabilize and keep the mouth together, which is what I used. Wow. So that every night, tears of you having to change the
Right. So they can immediately talk, and they can immediately brush their teeth the way he's doing it, where Sydney was banded together, so it was very hard and was really, other than little movements that the rubber bands were allowing, wasn't allowed to move her jaw at all. It's night and day between what we're seeing with Dr. Alfie's patients and what Sydney went through. And he was doing it then. I just didn't know. And that's why, to some degree, we're trying to shortcut this for folks.
Right.
We spent, 7 years in filming. You're 3.5 years out. But we spent two years trying to figure out who to go to solve the issue and to confirm that Sydney had an issue.
Sorry, so where did you go?
Where did we go for
her surgery?
We went to, actually that surgeon prefers that we don't say his name.
Okay,
so
all right.
Keep
Then
it
don't say
quiet.
that. Okay.
Yeah.
Moving on.
That makes it easy. Yeah.
You look fantastic.
Thank you. No, and I'm
feel-
extremely grateful. I can, it's always like hindsight's 20/20, right? Oh, if I knew then what I knew now. Of course, I wouldn't even have an airway disorder if we knew now what we knew.
Sure.
But,
yeah.
I am grateful for my experience.
Yeah.
I feel great. I'm happy with how I look. It's brought us here. We created a foundation that we hope to inspire others and help others. So it all works out how it's supposed to. But I am so glad to see that it's moving forward and that it's becoming more accessible, in that it's it's still tough, but an easier recovery, easier process. So
Well, I think everybody can relate to difficulties in breathing and anxiety, and
Yes.
you hit all of the symptoms that I would say 90% of us feel socially anyway, to some degree, and it's going to make a lot of people question. And I see this as an opportunity for that oral systemic awareness. So I'm so grateful that you guys were here today. Hearing your story was
I want
incredible.
to add one thing
Yes,
as
please
I
add
think
more,
about you,
please.
Camille, is that I feel like a new paradigm we've been talking about is that I think people should assume they have an airway disorder until proven otherwise, as opposed to prove that I have an airway disorder. And why do I say that? We're modern humans, so less breastfeeding, moving indoors, so you're allergic to indoor pets, rugs, carpets, more environmental allergies, and then soft processed foods.
Yeah.
And those things have changed, so we become more like pugs than where instead of having our upper and lower jaws grow forward and wide. And we can prove this. We've looked at skulls at the Penn Museum, and anthropologically, in just 450 years, we've gone from having room for all 32 teeth to rarely do people have room for their wisdom teeth, and most of the time they have crowded teeth. So it is a modern epidemic. And if you think about, if you had braces, you have a skeletal deficiency. If you have allergies, you're probably a mouth breather. If you didn't breastfeed, you probably aren't going to get the width and growth to your maxilla in the early year of life. And so, yes, everybody's got an airway disorder until otherwise. And so, oh, my child has anxiety, maybe they have an airway disorder. Yeah, they had braces, maybe they have an airway disorder. I know it's crazy, the numbers, but I'm sorry, if you're a modern human, you're on the precipice of having an airway disorder. And if you have these other symptoms, yes, I think you should get evaluated, and hopefully we grow more good people to evaluate
Yes.
the millions and millions and millions of people.
Following up that thought when it comes to a paradigm shift, right? And assuming we all have an airway disease or something of that nature until proven otherwise. Do you have any thoughts about current technologies or knowledge when it comes to, like, I wear my Fitbit, it tells me about my sleep quality, but I'm not observing my sleep all that objectively beyond, like, oh, I woke up with dry mouth one time and I drank alcohol the night before. So is there anything like this, the Oura Ring, or other things that could help someone in the general public to be more investigative about assuming they have an oral health disease and having a metric to follow through to test?
Yeah, I think the wearables are really helpful. I think they create awareness so that while they're not FDA approved sleep devices, I do believe they're giving you some significant insight, and at least from one night to the other. So in other words, if Jonathan's wearing that Oura Ring and it's, night 1, 2, 3, 4, and 5, and you see a difference, it's giving you some parameters of good sleep versus poor sleep for yourself. What we don't know is if your good sleep is truly good sleep because it's not an FDA-approved device. So I think it's a really good start. And then the home sleep testing is very available, so that gives more information about it. But I think younger people have more resiliency. If a 5-year-old falls, they scrape their knee and they get up and they keep playing. If my 95-year-old dad falls, he's probably doing more than scraping his knee, right? It's a trip to the hospital, it's a broken hip. Well, what's the difference? It's a difference in resiliency. So I think many younger people are compensating well enough that it's not an issue. It's just how preventative do we want to be? Because heart attacks are number 1 and stroke is number 3 in terms of the killers. And we know that compromised airways are a big root cause of these things. So if we could manage it earlier, then we could potentially change the trajectory with respect to these things like cardiovascular disease and dementia. So resiliency, it's a double-edged sword. It's really good because you can do life and you can power through and you have enough tissue tone and stuff that the airway stays open. But as you get older, at least have an awareness, man, I'm not sleeping like I used to, or I am tired. And that's where I am. I'm 62 and I feel tired. I don't like how I am at 3 in the afternoon, and I've tested, and I know I've got an airway disorder.
And
now
I videotape him sleeping with his mouth open and snoring.
Right.
So
and,
we
and
know.
at night, I always tape
receipts.
So now now what am I thinking? I'm thinking surgery, because I think it's the only thing that will, knowing what I know, I think it's the only way for
Improve
me to
your
solve
quality
the
of life.
problem. Yeah. So
Now it's going to be part 2 of the diagnosis.
Yes.
Yeah. Now I just committed on this radio show to doing surgery.
I know,
Well,
he hasn't told anyone in our family,
Yeah.
so
Well,
I know.
since
If anyone listens, this will be a test to see if
Yeah.
our family listens
That's
to what
right.
we do.
Sydney's like, Dad, when
Stay
are you doing
tuned.
the surgery? When are you doing the surgery?
I'm pushing him because we know, and we have to run this nonprofit together, and I can't do it without you, and I need you in good health. So
Let's
let's
get
do
going.
it. Yeah. What
Well,
are
we just
waiting for?
announced that somebody's getting surgery. It would be good to have, I think, in my opinion, like the young patient like you have, Sydney, and then, an older patient like yourself going through it, and the improvements that you see at each interval.
Yeah.
Fantastic.
Thanks.
Real.
I will say in that film, it doesn't have his name, but Mark Sullivan shows up in the film. Mark Sullivan's a best-selling author, and he told us that his ability to write, he had double jaw surgery, and that his ability to write after the surgery, and Mark is, he would be in his 60s when he had the surgery,
Okay.
and that his ability to write productively is unbelievable compared to pre-surgery.
Get
And,
out. I want surgery just because I know
and
I
his
probably have an issue.
his wife is a speech language
Oh my
pathologist,
gosh.
and she's the one through continuing education learned about this. And she was like, "Oh my goodness, I think that's your problem."
Wow.
So it's just really, really interesting. So
Well, hopefully
we
there's
do
more than
have
one
stories.
surgeon that can do it in an hour.
Yes,
Yes, we need to.
we want.
We need more.
We need more.
Yeah.
More in every.
Is he
every
taking
area.
on interns? What's
He
happening?
is.
Yeah, good.
So he always has a fellow. He's very much invites people in. I mean, as I said, we've watched
What's his
him.
name again? And what is
David
he
Alfie in Houston.
in Houston?
Yeah.
Oh, your hometown.
Just go home.
Yeah.
Hey, David.
Yeah.
Yes. And he's great. You'll meet him. He's
Yeah.
just
Yeah.
such a.
And he is.
down-to-earth,
He's
nice
training
person, yeah.
others. So he always has at least one fellow, and I think now he's got 2. And he does. He wants people to learn this. And and he's not. So anyway, you'll speak to him, and you'll enjoy that interview.
Excellent. All right.
And then just state the name of your foundation and organization.
You just want me to say it? It's called the Airway Revolution Foundation.
Love it.
And our website is airwayrevolution.org. We have lots of great info, and we're on our social media journey, so if you want to follow us, please do. It's a lot of embarrassing things, but we're working through it.
Yes.
Yes, but I think Dad found his new calling. I think you love social media and want to be an influencer. So.
I love it.
I didn't say that.
Well, Victor will try our best to
Okay.
make sure that our platform goes to your platform.
Good. And that our platform helps your platform because we're synergistic.
Exactly.
Name your platform again?
We're Let's Get Oral.
Let's Get Oral. The Airway Revolution Foundation needs Let's Get Oral.
Yes.
We're in it together. So thanks for what you're doing. Really appreciate it.
Yeah.
Thank you.
Hey there, listeners. Thanks for tuning in to Let's Get Oral. If you enjoyed this episode, don't forget to hit that subscribe button so you don't miss out on our next episodes. If you enjoyed listening to this conversation with the Avis family on Airway Health, stay tuned to hear more conversations on this topic with Dr. Alfie, Dr. Will Hang, and many more. If you have any thoughts, questions, or topics you'd like for us to explore, we'd love to hear from you. Feel free to send Camille and I a message on IG, YouTube, or any of the socials you're connected with us. And please leave a review on Apple Podcasts, Spotify, or your preferred listening platform. Your feedback will help us keep these conversations going and also improve our podcast product. Thank you for listening, and keep smiling, everyone.